Hi, this is Nancy Wilson. Welcome to Wilson Counseling. Today we're going to talk briefly about the physical symptoms of anxiety. If you're somebody who deals with anxiety, which is most of us, you've probably noticed that there are often physical symptoms that go along with the emotion of anxiety. And it's important to notice those physical symptoms and to try to manage them before they get out of control or before they feel too overwhelming. But I also want you to know what these physical symptoms are, because they can be a really good signal to us that it's time to get help. Whether help is just doing some deep breathing or exercising or calling a therapist. So let's talk briefly about what are the physical symptoms that you might be experiencing that are anxiety. Now, if you're having a lot of physical symptoms and you think there might be a medical issue, it is always good to consult with your doctor first. But if your doctor says that there's no physical ailments, in other words, there's no medical condition, then it probably is anxiety and stress that's causing those physical symptoms. So some of the common symptoms that are typical for people dealing with stress and anxiety include stomach pain, nausea. They might have digestive issues. I've had a lot of clients who have irritable bowel syndrome. So they may also have to go to the bathroom a lot, different digestive issues. Headaches are very common for people who deal with chronic stress. They may feel weakness or feel fatigued. Anxiety does wear you out because your nervous system is just on and going. Insomnia is a common symptom, or other sleeping issues. So you may find it easy to fall asleep, but you have trouble staying asleep. And so you wake up feeling tired in the morning. Rapid breathing and shortness of breath are a common symptom. You might also be experiencing pounding of your heart or increased heart rate. Sweating is common for people who are anxious. You might also notice that you shake or you tremble. And a lot of people also feel muscle tension or pain. Those can all be symptoms of anxiety and stress. I did want to note if you are having a panic attack, so some of you might experience extreme anxiety to the point where it feels like panic. Some of the symptoms of panic attacks can often mimic a heart attack. If you think you're having a heart attack, of course, go to the emergency room, talk to your doctor. But if your doctor says it is not a heart attack, it's not a heart issue, but you're still experiencing some of those things, it may be a panic attack. So some symptoms of panic attack: you feel like you're going to die, you have trouble breathing or feel like you're choking, you may have numbness in your body or feel certain sensations in certain parts of your body, you can have chest pain, you can also feel lightness and dizzy as if you're going to pass out. You can see how those things might mimic a heart attack, and that can be really scary. But oftentimes it is just a panic attack. And I don't say just because it isn't frightening. I know that's really scary for you, but it is something that is treatable. So if you're experiencing any of these things, talk to a therapist, talk to somebody who is trained, because anxiety is very treatable, including panic attacks. And the sooner you speak to somebody, the sooner you can start feeling better. I hope this was helpful and look forward to talking to you soon. Take care.